Thank you for joining us today for our second video session in the Duren's Pharmacy Wellness Program. Today our class is called The Sweet Spot. We will discuss the basics of diabetes. Today we will learn what is diabetes and how do glucose and insulin work, what are the symptoms of diabetes, who is at risk for developing diabetes, what are some complications of diabetes, and what is a normal blood sugar level. With some exceptions, most diabetics fall into the category of either type 1 or type 2 diabetes. If you're not sure which category you fall into, simply ask your doctor. Many times we can also tell based on the medications you take. Remember, neither type of diabetes is worse than the other. You may get diabetes in different ways, but both types of diabetes cause harm to the body in a similar manner. Patients with type 1 diabetes make little to no insulin and will always have to supplement their insulin with shots. This means they are insulin dependent. Most people who have type 1 diabetes are diagnosed with the condition as a child. Patients with type 2 diabetes may still make some insulin, but not enough to take care of the amount of sugar in their blood. In some cases, it is possible that their body no longer efficiently uses the insulin that they make. Type 2 diabetes is usually diagnosed later in life, but the number of cases of childhood type 2 diabetes has been on the rise due to the increase in childhood obesity. So how does glucose and insulin work? When you eat, your body breaks down food into glucose or sugar for fuel. Glucose is represented by the blue circles in the picture below. Glucose travels through the bloodstream to reach the cells in the body. When you eat, your pancreas releases insulin, which is represented by the yellow circles in the picture. Insulin is like a key that opens the gate to allow glucose from the blood to enter into the cell so it can be used as fuel. The energy in the sugar supports all the things your body needs to do to stay alive. Look at the picture below. In cell number 1, you can see the glucose channel, or gate, that allows the sugar to enter the cell is closed. The insulin receptor is like the padlock for the glucose gate. In cell number 2, insulin, the key to the padlock, opens the glucose gate. Then in cell number 3, the glucose gate is open and glucose is able to easily enter the cell. So how do glucose and insulin work in non-diabetic patients? When the pancreas and cells work properly, glucose is allowed to easily pass from the bloodstream into the cell. The amount of glucose in the bloodstream is kept within a tight normal range. Notice the amount of glucose represented by the red dots inside the cell. So how do glucose and insulin work in diabetic patients? In type 2 diabetes, cells become resistant to the action of insulin. In other words, the key for the gate to the cell does not work properly. The pancreas has to work harder to make more insulin. In some individuals, the pancreas begins to slow down after years of working so hard to make up for insulin resistance. The amount of glucose in the bloodstream is elevated due to the glucose not being able to enter the cell. Now notice there are fewer red dots or glucose inside the cell. There is a higher level of glucose in the bloodstream. So what are the symptoms of diabetes? Some of the most common symptoms include frequent urination due to extra glucose being expelled through the urine, excessive thirst, unexplained weight loss, extreme hunger, sudden vision changes, feeling very tired much of the time, and very dry skin. Some of these symptoms may indicate a different condition other than diabetes. Only a physician or other healthcare professional can determine if your symptoms are related to diabetes. Who is at risk for developing diabetes? There are some factors that increase a person's risk for developing diabetes. Some of these include advancing age, obesity, family history of diabetes, history of gestational diabetes in females, impaired glucose tolerance, physical inactivity, and certain race and ethnic groups such as African Americans, Hispanic and Latino Americans, American Indians, Asian Americans, and Pacific Islanders. The two most concerning complications of diabetes are increased risk of heart attack and stroke. The risk of having a stroke or heart attack for patients with diabetes is increased even more if the person has hypertension, high cholesterol, is less physically active, or is overweight. Smoking tobacco increases everyone's risk of heart attack and stroke, but can be extremely detrimental for those with diabetes. Other complications of diabetes include kidney damage, an increased risk of amputation, increased risk of infection, and peripheral neuropathy, which is a burning or numbness sensation in the extremities, typically seen in the feet and lower legs. So what is a normal blood sugar? Fasting blood glucose is tested after you have not had anything to eat or drink besides water for at least 8 to 12 hours. The fasting blood glucose level should be between 70 and 130 milligrams per deciliter. Postprandial blood glucose is the medical term for after eating a meal. We usually check this 1 to 2 hours after the start of the meal. The postprandial glucose should be less than 180 milligrams per deciliter. What is the A1C test? The hemoglobin A1C test gives us an average of what your blood glucose has been over the past 3 months. A higher A1C equals a higher average blood glucose. A lower A1C equals a lower average blood glucose. The A1C ranges are less than 5.7 equals normal, 5.7 to 6.4 is prediabetes, and 6.5 and higher equals diabetes. In the bottom right corner is a picture of the Bayer A1C Now device, similar to the one used to check your A1C at the beginning of the program. We will recheck your A1C again in approximately 10 weeks, which will be 3 months from the first A1C test. In future videos, we will be discussing in more depth ways to improve your health and diabetes. Topics will include diet, exercise, and medication therapies. Next week, we will discuss high cholesterol. Don't forget to stop by the pharmacy for a blood pressure check if you did not last week. You are invited to join us at Duren's for our monthly Sweet Spot meeting. Bring a friend and join us as we learn about diabetes. We meet the last Tuesday of every month at 7 p.m. at the pharmacy. If you have any questions about diabetes or need assistance with your medications, feel free to contact Macon Carroll, pharmacist at Duren's HealthMart Pharmacy.